And good evening, sirs. Today, we welcome you all another scientific initiative by Lupin Sinox. And today, we are very fortunate to have Dr. V K Jagnany from Ranchi. Dr. V K Jagnany is not only a name. Uh, Dr. V K Jagnany is a fame in the field of cardio diabetes. Dr. V K Jagnany is a consultant cardiologist and diabetologist, graduated from Bombay and postgraduate from Apollo. Sir has a teaching experience and has various publications, paper presentation, lecture on his credit. Dr. V K Jagnany has been awarded for his presentations. Recently, he had his international publication in an index journal too. Dr. V K Jagnany has chaired and moderated various academic sessions. Also, Sir has been chief guest and advisor panelist in various discussions. We are very fortunate to got Sir because Sir, nowadays Sir is too busy in the managing COVID patients with diabetes patient and also various scientific upgradation program. Sir served as Vice President of Indian Association of Clinical Cardiologists and Founder President of Jharkhand Chapter of IACC. Sir has organized IACC Con 2016, the 7th National Conference of IACC at Ranchi, Cardiozone 2019, Ranchi, the Zonal Conference of IACC, and Cardiozone 2020 Web Conclave 2. Sir, the renowned national and international speaker delivered their talk with the coordination of Dr. V K Jagnany. Sir has been awarded fellowship from Cardiacon and also having huge work experience. Now, Sir is associated with consultant internal medicine and cardiology at Agrasen Hridayalaya. Sir is RSSDI executive member of RSSDI Jharkhand Chapter 2, Vice President of Indian Association of Clinical Cardiology, and member of ICC, as I told. So, with this, today's topic is diabetes and COVID-19. So, we'll be having Sir for next 1 hour exclusively on the topic. And once again, I welcome Sir, and I also thankful for all of your presence in this CME. With this, Sir, all is yours, sir. Please.
Thank you so much. I am humbled by the introduction that you have given. I do not know whether I deserve this or not, but you have gathered a lot of information about me. Thanks to the Lipin team, Neeraj Manasji, Akashji, for inviting me here for this particular talk, diabetes and COVID-19, which is a hot cake, hot discussion as of now. Uh, I feel happy to share my thoughts with all the delegates who are here uh, so that we can have some better management of the patients in this tough time. So, to begin with, diabetes and COVID 19, we all know that diabetes is a major concern in India. It's worldwide going to be the capital of diabetes. We are seeing and we are worried that the diabetic population in India is increasing by leaps and bounds and is expected to almost double in coming 20-25 years. This is quite alarming. We are just next to China in diabetic population, and this is something which is quite worrying for us, and we all need to do a lot about that. We need to educate our patients, our population, how they can keep themselves safe. We all also know that diabetes is a major risk factor for infection from novel coronavirus, the COVID 19, as well as the morbidity and mortality is much, much higher in those patients who are suffering from diabetes. We also know that an uncontrolled diabetes and the disease process of diabetes in itself is a major concern for the various micro and macrovascular complications. And this multiplies further in presence of COVID. The prevalence of coronavirus in India is quite high. Last 1 month, 1.5 to 2 months, April and May, has been horrible situation for India. But I must congratulate, I must thank all the corona warriors who have done their best, risking their own life without thinking, and have given their best to treat the patients to prevent the spread of corona. Also, I must thank the Indian population who has kept themselves aloof from the society and helped in prevention of corona. This is increasing leaps and bounds. Fortunately, last few days have been giving some good news. The incidence of corona is decreasing, and also the mortality related to corona has been decreasing. So this is a great good news, and I wish and hope that we may prevent the upcoming so-called third phase of corona pandemic. WHO suggests that coronavirus belongs to the family Coronaviridae, and it is not the first time that we are talking about it. When this COVID 19 came last year, I was just curious enough to look back to my textbooks of MBBS days, and I could find that it has been mentioned, and we have studied about it in our microbiology, medicine, everywhere, but somehow we didn't see and it got ignored. But it has come back to us in as simple form of common cold to Middle East respiratory syndrome, cove type, or SARS, that is severe adult respiratory syndrome of cove type, which has been life threatening to many of our family, friends, and this is really heartbreaking. The novel strain of this coronavirus was detected about 2 years back in 2019 and has been officially named as SARS-CoV-2. Initially, we thought the transmission is from animals to human, but we have understood that it has not restricted itself to there, but human to human transmission is much, much higher. The incubation period is maybe as short as 2 days to 2 weeks. We do not have any specific treatment or immunization, but in last few months we have learned and we are trying to upgrade ourselves by every day to give better management and prevent the complications. As of now, we have four strains which are endemic globally, but we have learning that some more strains are in pipeline, or what I should say is probably because of the self mutant stage, it's being developing more and more strains, and it is affecting a large number of population. And one of the important complications is involvement of respiratory tract system. It was thought to initially start from bat and then the mouse and then various quadrupods and then the human beings, and then we have so many different lineage of coronavirus, the alpha, beta, delta, gamma, so and so forth. But now, in presence of diabetes, this increased risk of hospitalization and mortality is seen in presence of COVID-19. As high as 22% of mortality was in presence of diabetic in the presence of coronavirus. One of the studies showed that 32 of the mortality out of 52 were having diabetic population. Another study showed 16% of diabetic population mortality in corona patients. Another study showed 12%. So we are having a wide range of variation. It could be depending on the population, depending on the age, depending on the gender, depending on the presentation. But we are seeing that the diabetes overall is a high risk factor and increased severity of the disease in presence of diabetes. This COVID is more aggressive, more severe, more detrimental. Diabetes, we all know, tends to increase the risk of infection in general and more so in present corona pandemic. Poor glycemic control is another risk factor. A patient who is diabetic with well controlled blood glucose levels, good HbA1c less than 7, maybe have lesser risk of developing corona infection and its severity, and those who are poorly controlled will have more frequency, more severe disease, more chances of morbidity and mortality. Same holds true for obesity also. We have observed that there has been impaired immune response in terms of cytokine storms, the adipokines, the tumor necrosis factors, the interferons, the T cell. These are supposed to be the natural defense system of the body. But this virus causes impaired immune response. There is highly enhanced immune response, which becomes detrimental. And this also puts a platform for potential secondary bacterial infection involving lungs, which tends to reduce the ventilation, and this reduction in ventilation increases the chances of developing the viral as well as the bacterial pneumonia. In these times, we are also seeing increased fungal infection, which could be due to the lack of hygiene or the medicines which we are using, specifically steroids, which can affect the or enhance the chances of fungal infection. Also, some of the medicines which we are using are acting against the immune system, natural immune system. That is, we are trying to suppress the immune system because we are seeing overactivity of immune response in coronavirus. That may be one of the causes for the fungal infection also. But one of the things which we can take care is aggravate, be very much active to control the blood sugar levels when we are using steroids, which is one of the important causes for lack of glycemic control or loss of glycemic control, which happens suddenly during treatment of coronavirus due to steroids. We can add on insulin, we can add on drugs which are safe in this situation, such as DPP-4 inhibitors, specifically linagliptin, because that is one of the DPP-4 which can be used even in situations of renal involvement. So these two molecules which come immediately to my mind, which can uh, help in managing the blood glucose level to the normal situation, so that the complications related to diabetes or the increased morbidity of diabetes and corona can be prevented. Some of the common complications which we are seeing in corona is diabetic retinopathy, the ischemic heart disease, and the severity of these diseases is increasing. Why? Probably because of the cytokine storm and the inflammatory changes which is occurring. There are increased chances of thrombus formation, which block the end arteries and can lead to the increased ischemic heart disease. A poor glycemic control, we all know, is an important reason for the diabetic nephropathy. In such situations of diabetic nephropathy, we need to go for dialysis and we cannot stop it. Coronavirus is also associated with acute cardiac injury, which can also be associated with heart failure. This is happening probably because of the deterioration of circulation, and that is, we just talked, that could be due to the thrombus formation in the body. So the uses of enoxaparin, the uses of NOACs, which may be required post discharge, also is a mandatory. We may add aspirin, some statins, which can act as an anti-inflammatory agent. Because of the increased risk of acquired infection, which could be due to the environment, which could be due to the hospital acquired infections, which could be due to the immunocompromise, all this is dangerous in presence of diabetes. We also know that increased blood glucose levels has further increased the risk of infection. So this combination of diabetes and corona is detrimental. Generally, patient starts with presentation of fever, tiredness, dry cough, anosmia, that is loss of smell and taste, headache. In severe situations, patient may present with dyspnea, inflammatory changes, and some of the important risk factors along with diabetes include the elderly, the children, the smokers, and any chronic disease. The corona acts through the ACE2 receptors. In children, ACE2 receptors are not that well developed, and that is one of the important cause that we are talking about, the increased risk of children involvement in third phase. So we need to be very careful for preventing this disease, and for this we need to have corona culture, corona precautions to be taken so as to prevent, because prevention is the treatment in corona. When we are diagnosing coronavirus disease, we should take into consideration the age. A good medical history in terms of contact is very important. We have now available tests which can give results within few hours, and we have various centers for the control and prevention of disease where they are giving us information. We just need to follow these instructions so as to keep ourselves safe. Collecting the specimen from upper respiratory tract is important in terms of nasopharyngeal swab, and we need to screen temperature, and we need to ask questions to the patient freely and thoroughly so as to diagnose the situation. We must involve a diabetologist when we are treating COVID patients. We need to differentiate between common cold, flu, and coronavirus. In general, we have talked that coronavirus has an incubation period of 2 days to 2 weeks. Symptom onset is quite gradual. Mild cases usually recover within 2 weeks, but severe critical case may require up to 1.5 months. Fever is quite common, running nose is not so common, sore throat may or may not be present, cough is a very common symptom, body ache occurs, weakness occurs, and there is difficulty in breathing. So these features suggest that this could be coronavirus, and they should be screened and tested for the same. The laboratory markers suggest that invariably there is decrease in lymphocyte after the first week of corona infection, decrease in albumin levels, there is little decrease in hemoglobin also, and increased the inflammatory markers of CRP, ESR, LDH, and D dimer. In severe patients, there may be neutrophilia, increase in hepatic enzymes, that is SGOT and SGPT, and the cardiac biomarkers increase, that is cardiac troponins and procalcitonin, which suggests the involvement of cardiac injury also, and that should be managed. This is an X-ray suggesting the ground glass appearance in the peripheral side and usually bilateral, and it can be consolidative changes also, which suggests that it can be corona. Also, it shows that those patients who have fever and are positive for RT-PCR, that is reverse transcriptase polymerase chain reaction test for coronavirus, on this three-dimensional figure reconstruction, we see distribution of ground glass opacity as shown by the arrows in this particular picture, which is multifocal and is suggestive of coronavirus. We used to think that children are less prone, but the situations are changing probably because of the change in strain. But we still think that there may not be so much of cardiac involvement in children, probably because of their better immune system. But poorly controlled diabetes and obesity weakens the immunity and increases the risk of infection. So those children or adolescents who are suffering from type 1 disease or MODY are at higher risk of developing COVID, and the risk of lung infection further increases, and hence the morbidity and mortality. So we need to be a little more careful. In type 1 diabetes, in presence of COVID, we should prefer to the sick day management. That is what we do in any other disease process in presence of type 1 diabetes. Similar pattern should be followed here. This has been suggested by International Society of Pediatric and Adolescent in presence of diabetes, and a pediatric endocrinologist involvement will be helpful. We should continue with the basal bolus solution or the insulin pump. We must not stop insulin. We may have to check the blood sugar maybe thrice a day, before breakfast, before lunch, and before dinner. And we accordingly up titrate or down titrate. We should not hesitate in either of the situations. In most of the situations, we will be needing up titration of the insulin doses in the initial phase when we have started steroids during management of COVID-19. So we must up titrate when required, but we must maintain a euglycemic state, and we should frequently be monitoring about the blood glucose levels as well as the ketone bodies in the urine. We may have to add extra doses of insulin to do that, and we must avoid hyperglycemia, hypoglycemia, as well as the ketoacidosis, which can be done by maintaining the euglycemia status, which should be done by using the basal bolus regimen or the insulin pump. And we must not, I am repeating, we must not hesitate in up titrating the doses of insulin. When a patient approaches us, when we are trying to classify the patient, we should follow the trial system. Most of the patient must use triple layer surgical mask, which should be discarded frequently, which should not be reused. Patient should be put in an isolation room at least 1 meter distance. That is the minimum distance that should be maintained between two patients, and only similar patients should be put together. We must cover the nose, mouth, specifically during coughing and sneezing, maybe with a tissue or a flexed elbow. Hand hygiene is very important in prevention of coronavirus. Nowadays, we are having droplet infection. Yesterday, we were having droplet infection and aerosol infection. We should be preventing ourselves from spread of this transmission of respiratory viruses. Mask is important. Ideally, 2 meter of distance with patient. At least 1 meter is a must. Patient should be grouped of a similar etiology diagnosis together. Disposable should be used as far as possible. If some instruments which cannot be disposed, such as stethoscope, blood pressure cuffs, or thermometers are being used, they should be frequently disinfected and cleaned. We should avoid touching the environmental surfaces which has to be used by other persons also. We should try not to touch them. Adequate ventilation is very important in prevention of the disease. We must involve the health authorities when we see the symptoms suggestive of corona. Isolation is important. In mild disease, good hydration, symptomatic management, and home quarantine is sufficient. But we must keep close watch on them, because some of them may deteriorate and may require hospitalization or intensive management. For the management of diabetes, blood glucose monitoring with temperature is frequently required. Once again, I repeat, sick day guidelines, that is, insulin should be preferred, or those molecules should be there which is not causing any metabolic disorder. That means some of the molecules should be avoided, like metformin should not be used. We should avoid sulfonylurea because they have long acting and higher risk of hypoglycemia. We should also avoid the molecules which can cause volume depletion, that is SGLT2 inhibitors. So a combination of a DPP4 inhibitor like linagliptin and insulin will be the preferred choice in management of diabetes in presence of COVID also. So the slide once again says that we should stop using metformin and SGLT2 in moderate to severe illness, but we should continue linagliptin. Specifically, we are seeing because of the abnormal renal function, and where linagliptin is quite safe, and we do not expect any hypoglycemia with this, which is quite common with sulfonylureas. We should avoid even thiazolidinediones because they can cause fluid retention and increase the cardiac load. Type insulin is of course a preferred choice. A basal bolus combination, once again I would repeat, that is a better choice. We have some of the medicines, antivirals, which are helpful in managing diabetes. In oral, we have Flavivirapir. In injectable, we have remdesivir, we have tocilizumab, we have vitamin C and zinc, also some interferons, the IgG are there, which are helpful in managing our diabetes. But hydration should also be maintained. Along with that, we also need to use some other drugs, such as maybe azithromycin, maybe hydroxychloroquine, then mucolytics, then N-acetylcysteine, the bronchodilators, nebulization. These, depending on the patient, some cough expectorants, cough suppressor. We need to take care of the individual patient, and we need to individualize the treatment when we are managing COVID. So this is a tabular form of the various antivirals which we just talked, which helps at various level of disease process. Some act at viral entry, then transport, then replication of the disease. So these are the molecules which are helping us in management of diabetes against MERS and SARS due to the COVID infection. Some of the drugs which should be avoided is ibuprofen, because they may not be increase the risk of bleeding or involve the renal or hepatic functions. So once again, I would like to re-emphasize on frequent monitoring of blood glucose level, stabilization of cardiac and renal status, specifically in presence of comorbid conditions like diabetes. Good nutrition in terms of protein, carbohydrate, fat, vitamins, minerals is important. Exercise should be done, which helps in improving the immunity, but it should be done according to the capacity of the individual. We must not overdo exercise. We must not use anaerobic exercises, such as we should avoid exercise place which involves multiple involvement of people. We should try to do an exercise which is individualized, like yoga can be one of them, that is asana and pranayam. Walking can be there. We should avoid cycling, because that may put a strain on the cardiac system. So we have to individualize the things. In general, I can say we should avoid those exercises which involves more than one people. One second, like gymnasium, where many people are using the similar machines. Similarly, the swimming pool, these should be avoided. And we can go with simple walking, and that too at a pace which we are comfortable. Slowly, as the things will improve, we can increase the pace. Also, we should use a spirometer or respiratometer, which we can, by inhaling, we can push up the balls in the spirometer, which helps us to understand how functional our lung is. Vaccination, not only of COVID vaccine, but also influenza and pneumonia should be done, because that helps in reducing the secondary bacterial infection. Corona hygiene in terms of hand washing and avoiding contact with the affected person is very important. We all know that prevention is the best way to solve this rapidly spreading illness of corona. So to summarize, I must say that presence of COVID-19 pandemic and diabetes epidemic is a great concern. Treating diabetes to ensure euglycemia is very important. We must ensure good hydration, prevent infection from corona is the best method, and if there is infection, we need to have proper management with good glycemic control and prevent the complications associated with diabetes, which tend to increase in presence of diabetes. Things are better than before. We are learning day by day. We are trying to give the best possible management. A good attitude, a positive attitude, will help us to manage our patients much better. People are supporting in all the possible ways, and I hope to improve that further. Just to quote, darkest cloud also have a silver lining. With that, I would like to thank you all for your patient listening. If we have any questions, you are most welcome.
Sir, yes, we have few questions, but sir, I like
Sure.
the line, the darkest clouds have a silver lining. Sir, really, this is the time we need to be stay motivated. Really, thank you very much for the excellent session, sir. There is few questions. How how do patient go for RT-PCR test for negative report? or RT-PCR is required? I,
How do patient go for RT-PCR test for negative report? RT-PCR is it? See, it's like tuberculosis. It's something like we need to search for the diagnosis. If the patient is, if we are suspecting COVID, we should go for maybe repeated test one. Second, we have 3 4 tests with us: the antigen test, the rt-pcr test. If we are suspecting the pulmonary involvement, we can go with hrct. To begin with, we can have simple chest x-ray. So if we are suspecting COVID infection in particular patient, we should try and find out by all the possible means so that we can prevent the disease, we can treat it as early as possible and get the best result for that particular patient.
Sir, one more question is that, thank you, sir. Which steroid is better? I think dexamethasone and all these things they want to
Uh,
mention.
Best we are thinking about the methylprednisolone. Second best is dexamethasone. So these two drugs are common and probably the best choice. But if required and if they are not available, we can go with others also. For how many days? Generally speaking, we should use it for at least 5 days. If we are using say methylprednisolone, maybe 8 to 16 milligrams thrice a day to begin with. We have to individualize, we need to understand the symptom of the patient, the weight of the patient, everything needs to be taken into consideration and accordingly decide. In milder cases, we may not require oral steroids. We may just give inhalational steroids, and that can be sufficient. In moderate to severe, we will have to give oral or injectable steroid. So we have to understand the severity of the disease and accordingly decide, and depending on the improvement of the patient, we will see for how many days. Generally speaking, 5 days full dose and then we start tapering. Here tapering as such is not required because we are using it for short course of treatment, but we trying to taper and understand if the patient is comfortable with lower doses of steroid also, and so that we can withdraw it slowly and we can have the patient off steroids, because we do not also want to have the side effects of steroids. So shorter the better, but the patient condition has to be understood, assessed very clearly.
Thank you, sir. Sir, the next question is, how should a diabetic patient take precautions to avoid COVID?
Few things, for that matter, diabetic or non-diabetic patients, few things which should be done. We should avoid touching the surfaces. Like I will tell you simple example. If we are climbing a stair, invariably we touch the railing. We should avoid doing that. We should keep distance for at least 1 to 2 meters. 1 meter is minimum. Ideally, 2 meters of distance from any other person. Unnecessary, we should not touch anything. We should at least gargle, warm saline gargle at least once a day. That is minimum. We should not be overdoing anything. Inhalation, day in, day out, no faida. It can have some detrimental effect. Similarly, gargling, maybe 10 times a day. No, we should not do that. So, an ideal thing should be followed. We should go with once, at least once a day, warm saline gargle one. We should have good bath daily. That is a must. So, these small things will help us to prevent the corona infection.
Sir, one more question is there. Is there any options other than steroids?
First thing is, we classify the patient mild, moderate, severe. In mild patients, we can go with even inhalational steroids in the form of maybe nebulization, inhalers, or rota caps. That is one. Second thing, if we are thinking that this particular patient requires a steroid, that will depend on if we are given some basic treatment like azithromycin, paracetamol, maybe ivermectin, maybe chloroquine, hydroxychloroquine, and the patient is not improving. Suppose 3 days have passed, then we have to add something. If the patient here till now patient is not dyspneic, there is no dyspnea, chest is clear on auscultation, X-ray is clean. But even then, the patient suffers from fever. We have to give to steroids. we do not have a choice. So it will depend on patient. Even in mild patient, we need not start with steroids maybe from day one. But if we see little bit of dyspnea, we can start with at least inhalational steroids, and accordingly, if the patient improves, we can slowly withdraw it. If the patient doesn't, we have to go either for oral or injectable steroids. So that is one of the important part of the treatment, along with maybe azithromycin, maybe ivermectin, maybe doxycycline, maybe flavivirapir when the patient is on oral therapy, maybe remdesivir when the patient is admitted. If we are suspecting some dyspnea, we may, and D dimers are high, we may go for enoxaparin. If the patient is on OPD basis, we can go with NOACs along with aspirin. Statins may be helpful because they can act as an anti-inflammatory agent. We can go with mucolytics and bronchodilators. So we have to assess. We have a list of medicine. Maybe antibiotic, we have to upgrade ourselves to coamoxiclav, maybe ampicillin, cloxacillin, maybe cefuroxime. So it will depend on the patient, what is the severity of the disease, and accordingly we have to plan. One of the key things to take into consideration is that we have close monitoring of the patient. We must not ignore. We must check saturations, the blood sugar levels, the blood pressure, what is the oscillatory findings. Accordingly, we have to decide. We have to individualize the treatment, and keeping ourselves safe, that is also equally important.
Thank you, sir. There is no more questions. Also, all delegates and sir, please accept regards and gratitude. The way you all are supporting the humanity, really, we can see the silver lining after this darkest hour is fading away day by day, and you all have supported a lot. So the wave is also coming down, and thank you, sir, for such a wonderful deliberation of the talk. COVID is a really a great challenge nowadays, and diabetes add much more on this challenge. So sir was it was very simple to understand. And as expected, so in depth and in clarity, sir has made us understood. With this, we are at the end of the session. So I'd like to thanks from team Lupin Sinox as a journal head, sir, and all the delegates for making this program such an interactive and wonderful. Thank you, sir, for joining us. We'll look forward few more sessions in future also from you. And thank you for joining us from your busy schedule. And thank you all the delegates for joining us today. Sir, may we end the session now, sir?
Thank you so much, Lupin team. Thank you so much, all the delegates. With this, I would like to take your leave.
Thank you,
Maybe.
sir.
Thank you so much.
Yes. Good night, sir.
Good night. Please take care.
Yeah, sir. Take care. All the
Sure.
delegates, please take care. Thank you.
Sure. कहाँ से है ये exit?
Mr. Akash, can you close it down?
Yes, sir.
Yes.